For this video, I decided that I was going to talk about medications. I guess this mostly pertains to being bipolar, but you know, for the bulimia and stuff as well. But mostly the medications that I need to take are to stabilize my mood, which makes sense because bipolar, whatever, it's not funny. And yes, I decided to do it with this thing on my head. My mom gave this to me for Christmas, and it's so awesome. It's like a deranged squirrel sitting on top of my head. I think it's cute. So a lot of people will be like, what the fuck is that on your head? And it's like, it's a deranged squirrel. Anyways, medications. Okay, I keep them in this bag that says cute and nerdy. Do you see that? Yeah, owl. I love owls. I have an owl tattoo. Anyways, so one common medication that you'll probably hear about that a lot of bulimic people take is lithium. This is lithium bicarbonate. Was that? Well, yeah, that's what it is, but it just says lithium ER, and you take that much. Basically, I'm taking about 1 gram of that, which, and when you're on, which is not necessarily like a huge dose. I mean, it's a relatively average dose to be on, but you have to get blood work a lot. Like, there's like a very small little gap between what is therapeutic and what is toxic when it comes to taking lithium. So once a month I have to go to like a LabCorp place and get my blood drawn, and they have to test my lithium levels and some, my dog is scratching at the floor. Yeah. What was I saying? Yes, so you know, another blood panel. I don't know what all that my doctor needs to test for, but so far it's been like at a stable level, which is good. And then, you know, depending on when next time I see my psychiatrist, if we'll talk about, you know, the lithium levels. Anyways, because I probably need to go get another test soon. I also take Lamictal, which is a mood. That's I don't know how to pronounce that name right there, but it's the generic name for Lamictal. Lamictal's easier to say, and it's a mood stabilizer. But actually, first it was an anticonvulsant. It's a type of medication that people who have epilepsy would take for, well, epileptic seizures. But this one is also used as a mood stabilizer. I've been taking this for a long time, like since my junior year of undergrad. And then the last one is this one is Seroquel. It is Seroquel going on there, and I guess I really don't care that you guys know my full name because I just realized I showed that to you. But whatever. Anyways, this sounds bad when you say this. This is an antipsychotic. And then people are like, what? It's to help with the mania is what it's mainly used for, but it, you know, is also used to treat people with schizophrenia. You don't necessarily have to be psychotic, although I have gotten psychotic a few times, but it's not only given to people whose main problem is psychosis. It's really good for helping manic episodes. And they recently took me off a hospital. They recently took me off of an antidepressant because something with people who are bipolar, antidepressants don't work because it suppresses the depression, and then who gets to come back up is everybody's all manic and shit and stuff, and that's what usually would happen to me. It would cause me great anxiety. So you think, like, you know, with like a antidepressant, what's an anti-mania thing, sometimes that doesn't do well. I mean, I'm sure there are plenty, and I even know of one of my friends who is also bipolar and has to take medication, is that, what was I saying? I don't know. I totally forget. That is so fucked up. I'm sorry, now I remember who is taking an antidepressant, and that works okay for them. But there are a lot of cases when you, it does nothing, or it just makes your manic side go down. Anyways, and then you have to take these things daily, which kind of sucks. Like, it's in a way, for me, it's a little bit embarrassing. Like, if people were to see me do it. Like, this is where I keep all my medications, because I have to take some in the morning and I have to take them in the evening. And you see that's, I don't even know if you can see clearly. Anyways, that's a lot of pills. Which, well, I also put an iron supplement in there because I'm anemic, and, well, you know, it helps. Because of the certain doses that have to be taken, and it's like, in the morning, I'm like, you know, I have to get up, and I even have to set a timer on my watch, not my watch, I don't own a watch, my phone, to remind me to take my medication. I usually don't forget, but just in case. And I got to take them in the morning, and then you have to take them in the evening. And that's how a lot of, you know, treatment with medication is. I mean, so far, I think it's at an okay level. I don't know. I mean, I still got to go talk to my psychiatrist or anything, and I'm pretty sure that a lot of people out there who have bipolar can relate to having all this shit in a pill box, and it's like, you have to take a handful of pills. You have to, like, I have to take it with soy milk. I'm vegan. Because it's just gross taking it with water. It's like, you have to take like 4 pills, and they're big. So you put like a couple in your mouth and take a big swig of chocolate soy milk out of the carton. Well, you don't have to do it out of the carton. I do, because it's my soy milk and nobody else is going to drink it. And I can do what I want with it. And to have to like swallow these pills down, it kind of sucks. But, I mean, if it helps, it helps, but sometimes it doesn't. So far, I think it's okay, or whatever. So I guess this was just me talking about my medications and stuff like that, because being bipolar kind of requires you to take a bunch of fucking pills. Well, for the most part. I'm not going batshit crazy. I'm only like a little mad, not like off the wall. So I guess it's helping some. Okay, so I guess that's it for my video. I hope you guys have a good day. And Mr. Deranged Squirrel says, I love you. Bye-bye. Bye. Squirrel!